Thank you very much to our host, University of Bucharest. I will introduce Monsieur Professor Jinga, the Chancellor of University of Bucharest. Thank you very much.
Good morning, distinguished guests, partners, and colleagues. It is both an honor and a great pleasure to welcome you today on behalf of Carol Davila University of Medicine and Pharmacy from Bucharest to this important European event, the Shift Hub Innovation Day. We are proud to host this gathering here in Bucharest in close collaboration with our national and European partners, particularly COPAC, BEIA, CR of our university, and the wider Shift Hub consortium. The presence of so many distinguished researchers, entrepreneurs, healthcare professionals, and patient advocates underlines the growing momentum toward a more connected, patient-centered, and digitally enabled healthcare ecosystem. At Carol Davila University, we are deeply committed to fostering innovation that is both scientifically rigorous and socially impactful. We believe that academic excellence must go hand in hand with real-world relevance. Moreover, beyond supporting innovative initiatives, the University of Medicine and Pharmacy Carol Davila Bucharest is actively committed to research and training future healthcare professionals. We are aware of the challenges faced by the healthcare system, especially in the context of global health crisis and the rising number of patients with chronic conditions. In this regard, we focus on integrating digital solutions into the educational process, preparing students to leverage technology to enhance patient care. We also collaborate with research institutions and international organizations to develop projects that support innovation in medicine and pharmacy. Over the years, we have implemented continuing educational programs for healthcare professionals, emphasizing the use of advanced technologies and strengthening skills in innovation management. Our goal is not only to be leaders in education, but also to act as catalysts for change in the healthcare field, contributing to a healthier and more informed society. This is why initiatives like the Shift Hub Living Lab are so important. They bring together technology developers and end users in a space of open dialogue, rapid feedback, and co-creation. It is here, in these collaborative spaces, that innovation can truly serve that you need, it must, the patient, the healthcare provider on the front lines. Today's agenda is rich with ideas and solutions from AI-powered applications for elderly care to intelligent emotional monitoring system and non-invasive cancer screening technologies. But more than showcasing innovation, the day is about building bridges between academia and industry, between policymakers and citizens, between Romania and Europe. We are particularly grateful to the European Union and the Health and Digital Executive Agency for supporting this project and helping advance our shared vision for a stronger, more equitable, and digitally empowered European Health Union. I also wish to express my sincere appreciation to COPAC for their tireless advocacy and for ensuring that the patient voice remains central in this process. Let us use today not only to present technologies, but to shape the future, a future where innovation is inclusive, care is personalized, and knowledge flows freely across the borders and disciplines. I wish you all a fruitful, inspiring, and collaborative day. Thank you very much.
Thank you very much, Professor Jinga. I'm sorry for my emotion earlier. I want to say that today at Shift Innovation Hub, it's present all the consortium of Shift Hub. Welcome you all in Romania. And together with us, there are journalists, there are startups, probably a pharmaceutical company will join us. Today we'll speak about technology, about health technology. We have 6 startups and an application from National Institute of Informatics. We'll talk about technology and how the technology influence people's life. At the beginning of the project, I didn't know, and COPAC team didn't know exactly what we are doing in this project, because it was complicated. Many partners, many tasks, and in time we found out that we have a very important role. Our role is to link the technology with people. And also, I think it's important that we translate the technology for the users. And for that reason, probably, 2 weeks ago, we received an award. This was the award for science, and it was given from Radio România Cultural. And it was very important to us, and it's our prize to all of us. We did it together. And now we will start the event, and our first application and the first startup will be Cardio Online, will be presented by Ștefan Bușnatu, who is also cardiologist and professor at the University of Medicine. Ștefan? And vice rector and my partner in crime.
Thank you, Luminița. How much time do I have, Luminița? Because I finished my presentation in the morning. 15 minutes? 15? Oh, it's good. I understood at the beginning that 5-7 minutes, and I was very worried. In the morning, I was woke up at 6 o'clock by my wife. She told me that for 3 hours she was trying to get the baby to sleep, and she handed me the baby to put her to sleep, and I had to finish my presentation that wasn't finished by one of the residents with whom I'm in the team, and I have a lot of trouble before going to the hospital, because afterwards I needed to get to the hospital. If I have 15 minutes, then it means I have time. My name is Ștefan Bușnatu. I'm a vice rector within the Carol Davila University on biotechnologies, digitalization within the university. I'm part of the coordination team that manages the Center of Innovation in eHealth, which is partner for this event, and basically the Center of Innovation in eHealth is something that our rector built when he came on his first mandate, trying to drive forward the innovation and the eHealth solution in our regional and maybe national ecosystem, and hopefully European ecosystem, as I'm aiming more for our Cardio Online solution. I'm very happy to be here, and I'm very happy to welcome you in Bucharest, in Romania, and hopefully we will manage to build up with Paul, with Luminița, other projects, and for this I thank to the team of the Center of Innovation in eHealth that helped in preparing this event. I'm going to speak to you today about Cardio Online, as I'm a cardiologist. I do preventive cardiology, I do also interventional cardiology. I try to do a lot of awareness around preventive cardiology in Romania, and not also in Romania, because I'm also part of the European Board of Secondary Prevention and Rehabilitation in the European Society of Cardiology. I'm also in the board of e-cardiology, so I try to work into digital cardiology as much as possible. And since 10 years ago, I started my research activity, no, 12 years ago, the research activity with the PhD that was focused on telerehabilitation in myocardial infarction. And afterwards, I got involved in FP7, Horizon 2020 project, Horizon Euro projects that were focused around rehabilitation, virtual coaching, virtual assistance, and a lot of activities into secondary prevention, but I didn't manage to, as experience, because this is a very important role of this meeting. I didn't manage through any European projects that we were involved to get a solution, to get the support of the technical partners that were in the consortia, to get the support of the advocacy, to get the support of the legal partners, and to do the technological transfer with any of the solutions that we have been building in the European projects. And that's why I decided to create, let's say, my own or our own solution in order to be able to bring something forward, to have something to show, and to implement it into the life of the patients. So we built the Cardio Online, and we hope at the moment that it will help us build the future of digital cardiac rehabilitation. I think I'll use the keypad from the laptop. The problem, I think you all know, the problem related to cardiovascular disease is very problematic throughout Europe and throughout the world. As it is currently the #1 killer, and basically if we speak about 40% the average death rate annually in Europe, in Romania the problem is higher, it's around 55% deaths related to cardiovascular diseases. And it's not about the diseases itself, because when you die and that's it, you don't need any cardiac rehabilitation. The problem is that these are the numbers related to the deaths, but a part of the deaths, there are a lot of situations where you have like 80%, when you do 20% die, 80% get to live. Basically, you get 80% of the population with a cardiac condition. You say that it passed through a myocardial infarction, it passed through a heart failure event, and it needs cardiac rehabilitation. And this cardiac rehabilitation basically is a set of services, medical services, that encompasses medical therapy, physical activity that is surveilled, nutrition, psychological support, and social counseling in order to support the patient for 9 to 12 weeks to recover to a life that is as much as closer to the normal one. Because I don't know how many of you have suffered a myocardial infarction, hopefully none, but the idea is that the life shifts a lot when you get into an acute cardiac event, and afterwards you very frequently have the sensation that you're going to die when you have some small chest pains, when you have some palpitations, and these are very big problems because you start from cardiac disease, but you get to a mental disease together with cardiac disease. So basically speaking, we have cardiac rehabilitation throughout Europe. We don't have cardiac rehabilitation throughout Romania at this moment, but we are hoping that by bringing forward the new national plan for fighting cardiovascular and cerebrovascular diseases, we'll be able to, let's say, organize also in Romania cardiac rehabilitation. And as a matter of fact, I was part of the coordination team that managed the cardiac rehabilitation section within our national strategy of fighting cardiovascular diseases. What I showed you earlier was a recommendation. We have guidelines in Europe. We have guidelines that recommends to physicians to apply specific medical services, specific therapies to patients. Cardiac rehabilitation is a recommendation 1A, and basically the 1A recommendation means that each patient must do cardiac rehabilitation in order to have the proper treatment. The problem is related to the accessibility to cardiac rehabilitation at the moment. And that's why we built this solution, that it's an mHealth solution that is integrated with smartwatch wearables. And basically, it allows data collection from the patient and transmission to the data into the phone of the physician, or also on the dashboard, PC dashboard of the physician or the care team, because the care team is not only related to the physician. And it tracks the patient during his physical activity, taking his medication, doing his every step that he needs to be performed during cardiac rehabilitation. These are some interfaces and some images from the application that it's mobile and it collects. This is in Romanian, but at the moment the application is bilingual, also in Romanian and English. It collects everything related to the vital stats, the medication therapies, diet, and physical, psychological status, and also the dashboard that it's related to monitoring the patient, monitoring the physical activity sessions. And maybe this is the most important aspect when we speak about what gets it different than a basic telemonitoring solution. The general idea is that when you do cardiac rehabilitation, you need to monitor closely in terms of ECG, in terms of heart rate, in terms of the intensity of exercise the patient, as he needs to progress with small steps depending on his symptoms, depending on the ECG, in order to make sure that by doing physical activity you're not doing bad thing to him, because after a myocardial infarction there is a big risk for the patient on the rest of his life to do arrhythmias. And arrhythmias means that the heart rate gets irregular, and it could go in some conditions towards sudden cardiac arrest. And it's important to train the heart, but it's very important to train the heart efficiently in order to improve its function, not to make it worse. And I'm saying that because the benefits are very big. If you do a proper cardiac rehabilitation, we have research that shows us that the disease rate at 10 years reduces by 40%, the hospitalization rates reduces by 25%, and these are specific numbers, and also we have parameters related to the quality of life that increases a lot, and the productivity of the patients increase. And basically, this is the key aspect that is related to the application that basically starts with the stress test that the patient has to perform within the hospital. He gets into the application, basically the criteria is related to the targeted heart rate, the maximum heart rate, and all the alarms that should notify the patient that something is wrong and should get into contact with it. The physiotherapist is the one that manages basically the further monitoring and interaction with the patient. And if there are problems, the physician is contacted. And basically the physician manages the patient on the first interaction and at the last evaluation after 12 months, 12 weeks. These are the steps that we've made on building the solution. So we started in 2022. 2022, when I landed to the colleague that should have been here in this morning, I lent him a challenge to produce me an application that is capable of collecting the data from a pulse oximeter through Bluetooth. And after 2 days, I told him that I give him €1,000 if he manages in 2 days to build this application. And in 2 days, he built up this application, and he connected the pulse oximeter to a phone. And afterwards, I said that we need to do something together, and we built Cardio Online. We built Cardio Online, and we started working towards this application based on my experience and based on the experience of the colleagues. We managed to win a European project of €200,000 in order to build up forward the application, and we set it up in Buzău, a telemonitoring center where we are hoping basically to build soon a regional monitoring center. And at the moment we are expecting in June 2025 to go commercial. In terms of the activities that we did in parallel, as we are part of the university, as we know how important it is to create awareness not only in the citizens, to create awareness in terms of the academia, in terms of the professional, in terms of the research activity. We did, during these years, a lot of presentations at our congresses related to cardiology, to cardiac rehabilitation, to medical rehabilitation, that have been focused on the role of telerehabilitation, the role of the solutions, and the role of this solution for monitoring the patients. As we started, as you see, basically, we started from December 24, January 24, we started testing and using the solution lively within the hospital, in the Bagdazar Arseni Hospital, where we are working. At the moment, we invested, and basically with the fundraising that we made by the European funding, around €250,000. And now we are thinking about two business models. The one that is business to consumer, but the consumer is the doctor, and the one that is business to business with the private clinics at the moment, focused on rehabilitation. And maybe in the future we'll see if it will be suitable for the public healthcare sector. As I said to you, at the moment we don't have any landscape towards doing this, because the cardiac rehabilitation services, and speaking telerehabilitation services, are not reimbursed. The idea is basically to collect for the physician fee for using the solution with one patient of 20 euro per month. In terms of business to business, the idea is to sell the license of using the solution with the model that I'm going to speak to you in a couple of minutes, of telerehabilitation with 500 euros per month as license for 50 users meaning patients, the maximum number of patients, or also for 100 users. The general idea is that when you use cardio online, as I said to you, you speak also about the physician, which is cardiologist. You speak also about the nutritional part. You speak also about the physiotherapy that is needed. And basically, at this moment, we are supporting the part of related to the nutrition and support the physiotherapy. It will come embedded as the patient gets the information that has been provided by the medical evaluation, and afterwards, by using the solution, after the medical doctor sets out the intensity of the physical effort, then the nutrition and the physiotherapist monitors the patient as a service provided by this fee for specific patients. And generally speaking, our expectations would be, as to say, to come up as 5 clinics that would choose in the following year, basically, 50 patient plan for 500 euro per month, and 5 clinics that would choose basically a 100 patient plan for 800 euros per month. And also the B2C would be related to 20 doctors that will be capable of monitoring with the nutritionist, as I said to you, and the physiotherapist, because it's quite important to take into consideration that the model, I didn't plan to explain exactly what the model is, but by getting involved the physiotherapist and by getting involved the nurses, the doctor comes into play only when there are problems, because we always think about the time of the doctor, and that's why it's very important. And also to take into consideration that he will get into contact at the beginning and at the end when the patient would need the evaluation, and these are separate costs that the patient must ensure to the physician specifically. And basically the doctor monitors each 25 patients, and we expect after 1 year to have around 200,000 euro as income. In 3 years, generally speaking, we are aiming, hopefully, to get at 50 clinics, to get around at 150 doctors, with some automatizations that we are planning, and also to increase the capacity for 40 patients for each doctors. And this is the estimated total revenue that we are aiming. And also, in terms of the operational costs, we think that we would need around 900,000 euros for operational costs that are related to the infrastructure, to scaling up the infrastructure, to the further development of the solution, to the medical staff as a medical team that it's basically provided by the solution, customer support, sales, compliance, and legal. The general idea is that now this is a baseline, as what I presented to you. The topics and the development are also around arrhythmia detection, and also most of the wearables are tracking the irregular heart rhythms, and there are different services that can be developed around heart rate and around atrial fibrillation screening, which is another major problem when it comes to ischemic stroke, for example, and due to the fact that most of the population doesn't sense when it has atrial fibrillation. Unfortunately, they feel it when they make the ischemic stroke. This is the most important role, I would say, to the wearables to help in identifying early the arrhythmia. And on top of that, there are things that we are working at the moment, and we have literature in parallel related to the AI analysis of the voice in order to detect heart failure and to improve heart failure management, and this is for long life monitoring of patients with heart failure. The idea is to embed more the part of artificial intelligence in terms of nutrition and in terms of psychological support, as I don't know if you are well aware, but in terms of empathy and in terms of psychological support at this moment, the AI bots have some very good results, and probably in the future it will be much better. And basically through this, we think that we would have a competitive advantage, and not only taking into consideration the things that we already tried to create throughout Romania and throughout Europe, because if I speak about the competitive advantage, I speak also about the thing that I think it's the most important, the marketing, which I think we can do a better marketing that all the competitors that are at the moment on the market related to cardiac rehabilitation. And all these things are suitable for a solution that could be scaled up throughout Europe, as we are also working in Europe in the European Society on Cardiology on minimal criteria on telerehabilitation, and we are also working basically on getting the quality for the solutions that need to be implemented, and we are on the table on building the solutions. This is the team. It's formed from the beginning as I wanted to have also a young colleague to bring things forward that needed to stay with the students today, unfortunately. And I had to come, Dr. Sherbanoiu, and we have 3 technological colleagues that cover the mobile section, the front end, and they take over all the things, the major things that are related to the application. And I thank you very much for your attention.
Mulțumim, Ștefan. Thank you. In this moment, I would like to introduce the member of the jury that will offer feedback. Ionuț Tata, founder and CEO, Iceberg. Raluca Coșcodariu, international expert UEFSCIDI. Diana Purjol, executive director, HGD Group. Octavian Andronic, assistant professor, University of Medicine and Pharmacy, Carol Davila. And not the last, Paul Ștefănuț, co-founder, Booster Labs. The next startup is LD, friend of seniors. Do you want to put a question now or to keep at the end? Okay, okay.
Who wants to ask something?
I will start since
okay.
I think you can hear me, so...
And no, we use the mic for the live transmission.
Perfect. So, thank you so much, Stefan, for this great presentation. My question is, what do you need to achieve your ambitious goals? Because I know you have a lot of assets. I also know that you might miss something important, the time. So who will make this happen, and what are the resources needed for that?
You know, at this moment I would say that the problem with the time, I can't fix it at the moment, because this is the major problem that we are having at this moment. Everything comes up. I would say that although we have the team, we have other partners with whom we are working, I don't know why everything comes up to me to do the last word. And if I don't have time, that 2 weeks pass, and after 2 weeks we go on forward, and that's it. I think, and this is the discussion that I already started in Milano 3 weeks ago with some partners, some colleagues from Greece. The idea is that we are trying to find colleagues from abroad to try a little bit to shape the solution and to try to get the solution in that countries to be implemented. As I didn't get into detail, we are now using within the hospital the solution. The patient comes, he does 3 weeks ambulatory rehabilitation, and afterwards he gets in 9 weeks research tele-rehabilitation. So we shape up the ecosystem, and we would need to do this deployment in terms of the protocols in other centers throughout Romania, as we already started in Iași. In Romania, we have a good coverage, I would say, in Târgu Mureș, and now we are speaking about Cluj in order to the implementation. We need to go on abroad and to try to adapt it a little bit to other landscapes. This is something that we would need. Apart of that, I would say that only the time is the thing that I feel that we need.
Do you need a CE marking for the reimbursement in particular? I think that only Belgium, Germany, and France have reimbursement schemes for digital therapies. The other countries, I'm not aware of.
For DIGA, I'm sure that we need to go to the process of certification as a solution to be reimbursed. But I don't know at this moment, because probably we need to build up the model for doing rehabilitation, as we have also colleagues from Germany that are working on these criteria in Europe.
This is a great asset because the clinical trials cost a lot usually, and being from within the, let's say, ecosystem, medical ecosystem, it might accelerate a lot. But
Thank you.
Thank you.
Thank you, Paul.
Other question?
Hi, thank you very much for the presentation. Gabriele Casalini, European Digital SME Alliance. Just a quick question on the concrete part, on the implementation. As you rely on sensors and possibly smartwatch, did you find any challenges in using particular devices, even products or brands?
At this moment, as I said, it's a very sensitive idea to do cardiac rehabilitation with patients and to monitor at home. For example, to give them the ring and do the heart rate monitoring, it would be a nonsense. And some other problems are also related to the type of activities, because if you do this 12 weeks and you need to make sure that the patient is safe, it's good also to do safe physical activities. And for the watches, for example, in order to collect and to track the data as accurate as possible, it's very good to use the bike or to use the elliptical bicycle in terms of physical activity, or when you go on the treadmill, to be sure to say to the patient that during his activities to keep the hand on the bars. And these are aspects that we identified also by using Samsung, by using Garmin, by using Apple Watch. We have some information from the literature, but it depends a lot on the vascularization of the patient. It depends a lot on the mobility of the wrist, and that's why it's important that he holds the hand as fixed as possible during the rehabilitation sessions, so we track on that things are going well. Because he is also doing physical activity outside, but when we need to monitor it, we need to make sure that there aren't problems.
Apologize because I missed the start of your presentation, but since I need to jury, I want to check everything. So, have you already published some of the research findings from exploiting the technology?
Yes. We have a publication. I presented. We have a publication in Frontiers. We have some abstracts that have been presented this year to the European Congress of Preventive Cardiology last year. This week, at the end of this week, I'll present something at our national conference on cardiology. We did, I would say that we did a lot of academia awareness in the last 3 years.
Okay, and the research protocols, who has designed them?
The research protocols have been designed basically starting on the European guidelines on rehabilitation, and have been developed by us at this moment. Because in terms of, I would say for you, I don't know if you are aware, as I told you about the guidelines, this year in 2025 at the next European Congress on Cardiology, it is assumed that it will be launched, the first guide on cardiac rehabilitation, the European guideline on cardiac rehabilitation. We have manuals, as I'm part of the manual in Romania that the treaty, the medical treaty that, let's say, manages the cardiac rehabilitation and the protocols, but the one we have refined by piloting and testing.
Okay, okay. And I'm going to go back because Paul asked a question I was going to ask, kind of, but I'm wondering about medical device registration because I think that's, if you want to go in the reimbursement scheme, that's needed in those countries as well. But also there's the medical device registration with lower classes can also help you establish yourself on the market, so on international market. So I'm curious, is that a priority for you to go through medical device registration at European level?
At this moment, I would say to you that these things are very ambiguous at this moment to me. This is one of the reasons that I fully support these activities because, for example, when we discussed with Samsung and we discussed with Apple, they sent us the CE marking as to be devices also for collecting ECG. And for atrial fibrillation, for example, in terms of certification. And somehow, I think for sure we need it. But it's not clear to me if you use, for example, the Galaxy Watch that it has at this moment a 2B certification, and for heart rate monitoring, for example, if you need to do additional testing or you need only to prove that you're using a solution that is already certified.
Depends who measures.
Because the decision is taken by the doctor, it's not taken by the device.
Okay, and that's a very good point. Okay, thank you.
Okay. Do you have another question? Okay.
Mulțumesc mult pentru... sorry, English. Thank you for the presentation. I think it's a great idea, and we know that cardiovascular disease is #1 of that in Romania, at least. My question relates to how do you plan to penetrate the market? What are the distribution channels? And another question about the traction. What has been your experience in terms of adoption and compliance with the solution you've provided?
There are two problems related to the adoption, but I'll start with how to approach the market. The market will be approached directly. And directly means by calling every potential client, as we already drafted the clinics, the rehabilitation clinics, and the rehabilitation clinics will be contacted and then presented the solution. For the medical doctors, the situation is the same. As generally speaking, in Romania, we have the preventive cardiology and rehabilitation group of medical professionals. We know all of them. And these are the first one that have been approached. As I said to you already, we discussed and we implemented in Iași, in the rehabilitation hospital in Iași, in the cardiac facility, in Târgu Mureș, in the Târgu Mureș hospital, in the cardiac rehabilitation facility, and now discussing in Cluj. So this is our aim at the moment. We also work, and I'm working 5 years on a national cardiac rehabilitation platform that is called recuperare-cardiacă.ro, where I try to increase the awareness for the patients, but also to increase the awareness for the clinics and make them feel that they can engage more patients if they involve more into the marketing part. And when it comes to adoption, the idea related to adoption for the patient, it's easy. Everyone wants it. In terms of adoption, the problem is when they need to pay for the solution, and this is something that we don't speak about the national segment because nothing is reimbursed. We initiated some discussion with the private insurance, but we don't have any feedback at the moment related to this idea and to this model. And in terms of the doctors, in terms of the adoption, because the doctor should use the solution, what we have as experience from Iași and from Târgu Mureș are good feedback as they use the solution, and they use it for free as they also do research at this moment. And hopefully we will have a good adoption, but we need to be targeted. It's not for everyone at this moment, and we need to pick up the specific persons. And that's why I made also this plan that I showed you related to 20 doctors and 5 clinics and 5, because I know that the road is quite long indeed, And I'm mostly also thinking about getting abroad a little bit in terms of doing a better adoption, as when you already have a model, as we speak also for in Belgium, that has some hybrid models of rehabilitation, and they publish a lot in Germany, they have something. There is nothing structured at this moment to be something structured and applied to part of Europe, but there are solutions that already have been somehow implemented throughout Europe, and there are a lot of patients. When you feel that you have a lot of patients, you know that you need to do something to get to them.
Okay, if there are no more questions, thank you very much, Stefan. And the next presentation is Teofil Sturzoiu, LD, the Friends of the Senior. This app was the winner at the last hackathon organized by University of Medicine and Pharmacy last year.
Hi everybody. So we are LD, and our mission is to slow down mental deterioration among seniors. So the problem is clear. 69% of seniors want but don't know how to monitor and care for their mental health. And also seniors hide problems from their children. So we are trying to bridge this gap. The statistics show us that the market is huge. Right now in Europe there are 21.6% seniors over 65 years old, and the percentage is increasing towards 25% in 2030. Our solution, we developed an app, a virtual friend, and we integrate frictionless AI in seniors' lives to calculate their brain score. So, we already launched the MVP. We have around 500 users, seniors here in Romania. They join the app, they play scientifically validated games, and chat with the virtual friend. From there, the virtual friend analyzes their activity and calculates the brain score, which we show to the caretakers, to the family members. So, for the senior account, we track feelings, social interactions, and other metrics to always keep a holistic view on seniors' life, and use the holistic view to create a personalized physical and mental activity plan and roll it out to integrate with their day-to-day habits. For the family account, our mission is to alleviate their concerns and to show them every day insights about their parents' and loved ones' health. As I said, we already launched the app. We have around 500 seniors using it quite frequently. We also have a lot of daily active users. It's senior first, always there for them, and entertaining and rewarding. So right now the app is centered on seniors. We have two types of accounts, as I mentioned, seniors and caretakers. The seniors join the app, it's all frictionless for them. They chat with the virtual friend, and through the virtual friend we push information and games targeted towards them. And for the family app, I inserted two pictures here. We offer insights, detailed overview, and save time for caretakers, because we can check with a simple click how our loved ones feel during that day. The monetization part, we are targeting two main areas right now, B2B2C and B2B. For the B2B, we are targeting care houses, and we already have a partnership, but I'm going to mention it a little bit later. And for B2B2C, we are targeting corporations that want to offer the caretakers account for their employees as employee benefits. So far, regarding partnerships, we have a partnership with Alfega Pharmacy, the second largest pharmacy chain here in Romania. They are going to promote our app in all of their pharmacies physically. So far, they promoted us in their virtual magazine. We recently started the partnership with Teleassistance Group, which is present in 5 countries, including Belgium and France. They already have customers. They are selling devices, hardware devices, medical devices for seniors and caretakers. And we are going to add the LD account to their package, and show the caretakers all the detailed information from both physical devices and from our app. We implemented our solution, or we are in the process of implementing our solution in Affinity Life Care, the premium care house here in Bucharest. And we are receiving guidance from University Carol Davila as part of the prize we received from Johnson & Johnson last year. As for the current prospects, we are in discussions with BCR. They already agreed to include the LD application in George Marketplace, so for every BCR customer in Romania. And right now we are deciding on the terms to include LD as a benefit for their employees. And by autumn, we will be present in at least one care house in Strasbourg. We have a warm intro from a doctor who is developing robots there. And he's going to introduce the app to at least one care house that also has those robots. As for the early distribution channels, as I mentioned previously, we are going to join 800 plus Alphega pharmacies in Romania. We already have 500 accounts only on Android because we didn't launch on iOS yet. We have partnership with the biggest NGOs related to seniors here in Romania, with Active Aging NGO and Never Alone NGO. And we are working with TZMO, which is the supplier for all care houses in Romania and Poland. As for the teleassistance group, as I told you, we are going to sell as part of their package. So far, the milestones: we won a grant from Johnson & Johnson last year. Right now, we are part of Innovation Labs program, and we are targeting a pre-seed round pretty soon. The team is both technical and medical, so we have experts both in the AI field and in the psychiatry field. And we are backed by a strong board of advisors with experience from multiple areas, including business, PR, and medicine and technical. So we are LD, app is already available. And scan the QR code, get in touch with us, and let's get closer to our families.
Thank you, Teofil. Questions? Who wants to break the ice?
So my first question relates to what's the target market? Is it Romania?
We will start here in Romania, but we are targeting Europe, mainly other more technologized countries.
And you're partnering with Alphega pharmacies, but
yes.
Your business model as clients, you have employers and senior care houses. How does the partnership with the pharmacy chain helps you in reaching out to these clients?
Yeah, so a lot of seniors and caretakers go to the pharmacies to buy medicines for themselves or for their parents. So they will see the advertisement there in the pharmacy.
Mm-hmm.
We are going to promote them. They are going to promote us. It's a quid pro quo. So we are not getting revenue from them. Right now we are not focused on revenue. We are focused on growth. That's why also BCR so far isn't paying anything, and also the care houses. We are not, as I told you, focused on revenue, but on fast, accelerated growth.
So what are the challenges that you see with regards to adoption, and what would you need? Like what kind of partnerships or support you need in improving adoption? And how big is this market that you're targeting?
Well, the market, as for the users, since the seniors are our main users, it's in Europe around 21% seniors over 65 years old. Out of which, if we analyze the data, 3 out of 4 use already smartphones, so technology. So the question was related to adoption, right?
Yes, particularly that because in Romania we have two challenges. One is monetary, and the other one is so purchasing power, and the other one relates to technology readiness. So I wasn't very sure about the added value, or like how big is this target market, given these restrictions.
Yeah, in Romania, out of 4 million seniors, we already have, or 1.2 million seniors already have Facebook accounts. So they are using their mobile phones for technology. So we are targeting those 1.2 million users in Romania, and in other countries there are bigger numbers. And for the adoption, we were surprised to see that a lot of seniors are already using our app, and we got a pull from them to add more content, more games, and to launch it on iOS. We actually got an email on Friday at 11 p.m. from an old lady who asked us when we will launch the iOS version.
Okay, thanks.
So that was a little dose of motivation for us.
Yes, thank you for the presentation. To complete maybe on Diana's question, even if they have a Facebook account, there is still a, let's say, digital illiteracy. And this can be overcome through, let's say, a pedagogical approach. How do you plan to overcome this digital illiteracy? It involves online payments, which a lot of people are skeptical, in particular the elderly. The use of the application itself, understanding how it works. How did you plan and integrate all this in?
So we removed the online payments from seniors. That's why seniors have free access to the app. The ones that are paying are caretakers to track their parents' health. And for the app utilization, we made it as simple as possible. As I mentioned, we are centering all the features around the virtual friend. So they chat with the virtual friend exactly like on WhatsApp. Also, we noticed a little problem for some seniors. They are not familiar with the standard sign-up form. So they didn't know how to complete the form. That's why we changed the approach, and they create their account while talking to the virtual friend exactly like on WhatsApp. I inserted the photo here. They are chatting with the virtual friend, and we are creating their account in the background. So it's targeted for seniors, and we make it as easy as possible for them to use.
Perfect, thank you.
Hi, yes. Okay. Hi, thank you for your presentation. Anita Varela from Aristotle University Thessaloniki. My question relates to the games, because you mentioned scientifically proven games. So I'm wondering, can you tell us more about those? Because it's a very specific target group, and again, digital illiteracy is also part of this. So when talking about phone apps, how are they familiar with those games, older adults? Have they been validated with older adults? So that's my question.
Yeah, so our medical colleague is not here today, but she sent me, and she did some research on there are papers that show that some games are related to the improvement of mental health, including puzzles, Sudoku, pair games, and so on and so forth. We are going to track the evolution of the seniors while using the app on a longer period of time, but we have the papers that, the research that shows us how it improves their lives over time.
Okay, thank you.
You have, you said there's some articles. Good. You said you have some articles, but I understand they're not written by you. They don't come out of your games, but they come out of third-party sources?
The articles are related towards the Sudoku game, puzzles, and so on. So we implemented the games that are researched in those articles. We are going to have our own research when we'll have the funding to do so.
Okay, but you already have commercial rollout at this moment, so you already sell the app while you don't have your own research.
It's
behind
free,
it, right?
it's free.
Okay.
And we are not, right now we are not marketing it as a medical app, but
Okay.
as a wellness app to improve their mental health.
So it's free and everyone can use it. Do you have a business model now for it? Or?
No, it's free for everybody. Nobody is paying right now. We, as I said, we are focusing on growth and getting as much data as possible.
What's the plan then? I mean, when are you gonna start making money with it?
Right now, we are targeting a pre-seed round to sustain the business on for the following 2 years. And
I mean, pre-seed is gonna come when you say how you're gonna make money. So that's why I'm asking.
Yeah. So we are monetizing on B2B and B2B2C, as I showed you in the slides. I would say that for the following 3 to 6 months, we're not going to charge any tax from anybody.
But you have an estimate of how much
Yes,
you're gonna charge
yes.
later on. Okay, good. I would like to go back to what you said about the research that you're gonna be doing. So if you were to do research now, because I mean, there's some articles out there, scientific articles, I assume, yes. And now you put the Sudoku games and you put the other games in here. You act as an avatar, as you said, which is a good idea, of course. How will you be measuring the impact and the correlation between the mental state and your app? I mean, how are you going to isolate the contribution of the app to the mental state in measuring the impact? And I know you're not a medical guy here, but I think some basics you already know about this, right?
Yes, so in order to measure more accurately, we are analyzing their answers in the chat as well. So our plan for the future is to implement the AI models that are already existent and analyze their voice and facial expressions to detect signs of Alzheimer's, dementia, and so on and so forth. And to be more precise regarding how games will improve their lives, we are going to track the evolution for each game individually and the evolution overall. And if we see an improvement in that game specifically that correlates to the improvement of their overall health, I assume that would be a validation. But as you said, I'm not a medical guy here.
Okay, we'll have to talk further about this. Thank you.
Thank you.
More question? No? Then thank you, Teofil, very much.
Thank you.
The next presentation is SymptoChat, Victor Constantinescu.
Yes. Thank you.
Hello everyone, I'm Victor Constantinescu, co-founder of SymptoChat. Behind me is my deck. It's not the prettiest one, but I will just explain what it's all about. SymptoChat, how we start the idea and what we want to do next. So, SymptoChat started 1 year ago as an MVP for a symptom checker. The goal for it is to test our AI capabilities. We launched it on iOS, on App Store. It has been tested by doctors and users. What SymptoChat does is to offer you some informations, right, from an educational perspective about your possible causes for your symptoms. We managed to test it in clinical vignettes and also in real time with the doctors, so they actually use our application, adding informations there, getting some pre-diagnostic or pre-causes for a couple of patient symptoms, and we scored about 92% accuracy into the clinical vignettes tests. We launched it, it's being used right now, but again, it was just a testing ground for our AI, because we are developing an AI based on medical QA databases and also other medical databases that has millions of medical insights and inputs, if you want. The technology, it's still young. We are not quite there yet, but we are evolving. Okay, in startups, usually you pivot, right? Because you don't stick with the original idea. But we had a lot of good findings on our perspective on what the medical health industry looks, what are the problems. And based on all these findings, we want to pivot. And we want to, it's actually SymptoChat, what it's doing, it's evolving from a basic symptom checker into a prevention as a service platform. Why I'm saying it's prevention as a service? Because today it's very hard to sell prevention, right? Not everyone wants to prevent health issues, especially users that are healthy. It's really difficult to conduct and present in an educational way why they need to do it. But based on our findings and based on our research, we know that users value their health, okay? So it's a cat and mouse game. It's about convincing and educating users to use and take certain type of screenings, personalized screenings based on their health profile. How we are using that and how we will actually plan to do this is to incorporate, our strategy is to incorporate different data points, starting from wearables devices, IoT devices, also medical history of the patients, that is being added manually by the patient. We also want to incorporate DNA tests because those are very granular and it helps on the process. And taking all this data and putting them together, we can make a personalized experience for the user. And we can actually recommend certain type of screenings and lab tests, right, to conduct and to check from time to time if your health it's good. The scope of it is to prevent chronic illness once, and the second, it's also because we'll have patients with chronic diseases, right? We want them to better manage the progression, reducing the complications, and also improving the quality of life. But again, the question is, who will pay for it, right? Because I don't think a regular user will pay for an application to get some prevention advices or lab tests and so on. And we are thinking to actually turn this, if you want, to turn the awareness into action, because everyone knows that health problems is increasing worldwide, especially the chronic diseases. And we want to collaborate with who else than the health providers, right? The doctors, the hospitals, the insurers, the employers, and why not the state, right? Because we know that many countries out there has some typical prevention services on place, but if you want, the end goal of this or the results of their actions is not so good. Why? Because users have, when I'm saying users, sorry, I'm from product. When I'm saying users, I'm referring to patients and people, right? Like you, like me. Yes, sorry. Anyways, yeah, this is just for a pretty presentation. Okay, so the goal is to actually make, and because users, the patients have different type of barriers, right? They're asking themselves, why do I need to take a screening? When do I need to take it? What type of screening do I need to take as well? And we want to educate the patient to understand what are their health risks, because every one of us, based on the family history, based on their current health area and status, and also based on where they live, because it's also important, where do you live, what is the pollution level. So every data we are taking into consideration into the application, so we create this personalized profile. And also based on this, we incentivize users, right? So let's say I want to do a screening for diabetes because my mom has diabetes, right? If I'm taking that particular screening at, I don't know, just putting some names, Regina Maria or whatever else, hospital, then I will get some points, some symptom points, right? I can use those symptom points to go to, I don't know, to the gym to have a better, to have a cheaper gym program, or I can, I don't know, buy some cheaper food with that and so on. So we want to use this inch device for the users to use it, and to use the doctors, to use the health providers as our advocates. Why the doctor will want to recommend an application like SymptoChat? Because it's definitely improving the outcome of the patient, right? Inside the application, the user can have the possibility to share their data with the doctor. So upfront, if I'm going to a doctor, they will know my history, and they will know what are my health problems, and also that will improve the preventive care outcomes, and yeah, I mean, healthier patients, and patients that with their health that is not being I don't know, going down the way to hardest problems. Employers can offer the application as health benefits, right? So fewer sicker days as well. Also, the health insurers can reduce the claims, so lower claims with early detection, because what SymptoChat does is also early detecting your health problems, giving you information about what do you need to do next. And this is it. I mean, if you imagine 5 years ago, prevention as a scale was pretty impossible, but nowadays it's totally doable with the help of AI and IoT wearable devices. It's doable. Thank you. Questions? Yes.
Okay, thank you. So if you were to receive funding today or in the next days, what are the specific milestones you want to achieve with this funding?
That's a very good question. So, first of all, as I'm pretty sure 99% of you knows, it's a heavy, I mean, not really a heavy, but it is a regulatory path we need to follow, right? So this costs money. We need funding to actually start getting some approvals from the EU, especially because application, it's mainly, it will start in Romania, it will extend in EU, and we also have US into the future. But for now, we want to get the regulations done, and yeah, that will help our funding. And second, we actually started creating the MVP for this application. Again, SymptoChat, the old SymptoChat if you want, and the new one that it will be like it will be a platform for prevention. It's based on our own founding and our own time. We are a very small team of 3 people, but the founding will accelerate the development of this application, because imagine we need to add and incorporate a lot of technology into this. We need better servers, so that will be the second one. So first, regulation path, the second, the development path.
Hello, this is George Suciu from company BEIA. We are also partners in the Shift Hub project, and one question would be if you have done any market studies or clinical studies for Romania or for Europe, and how you will scale if you will have it only in Romanian language, or if you want to go so international.
When you say studies, you're referring to the problem itself, it is a real problem, or about if the user will use this application?
Yeah, how you will go to the market.
Okay, it's a good question. So, of course, we did studies, we talk with medics, we talk with people, we did our own studies about different countries in Europe, how they actually promote prevention, what are the pain points there, and we saw that, I mean, as you see here, we know that Romania has the lowest prevention rates in EU, right? So this is a fact. Just an example, 9% mammography coverage versus 60% in EU, so this is very low. So I think Romania, it's a good testing ground for prevention, because I think if we manage to succeed in Romania with this, Europe will follow, will not be a problem.
Okay, thank you.
Thank you.
Maybe just a clarification question. So we are speaking about prevention. What you're saying is that people, like an individual, they have some they suspect that they may have a problem, and they will go on your platform. The way they can do it is themselves, or they go to a physician, and the physician recommended you do that. And maybe I missed, what are the other ways of going to this platform? This is a question. And the second question, how do you plan to incentivize the physicians to be part of your service? And two, what are the acquisition costs? And have you also considered partnering with pharma, given that somehow you're also improving the diagnostic rate, and we know that this is one way to increase the market share?
Okay, so to answer your first question, we do have an onboarding in place. The onboarding on the application means that we ask the user who recommends you SymptoChat if you solely install it because you are health aware and you want to prevent complications and risks. And second, if a doctor recommends you the application. Second, we want to, in our opinion, the doctors can be incentivized by actually being involved into building this product. Because we don't want to promote SymptoChat that is built by me, or by our co-founders or who else. No, SymptoChat will be built with medics, right? So at their recommendations, testing with medics, medical professionals, and medical providers, right? So I think this will bring doctors in the front line, as usual, right? But actually creating innovation. So it'll be part of innovation. I think this is a good incentivation for medics. And of course, being part in workshops and so on will be a second type of incentivations. And imagine the family doctors, right? We have a lot of them in Romania, okay? If the medic, the family doctor, knows about the patient, follows his progress, the health progress, accessing a program, because we don't want to add on top of what the doctor needs to do, we want to make the doctor's life easier. Nobody wants more processes, nobody wants to input more stuff. No, we want to make everything easier. So how we make this easier is by actually the doctors knowing about his patients, what are the problems, and following into the application we'll develop. Second to SymptoChat will be a backend application, a cloud one, sorry. And he will see especially for the chronic illness patient, where we can actually monitor their data with wearables. They will see the patient progress and the health problems. So, and that will reduce the overwhelming, the burden, if you want, on the medical system, because you will not need to call if my head hurts anymore, right? Or I don't know, I have a belly problem and I'm going to the doctor and to the medical, to the hospital at least, and we can reduce this, but actually keeping the doctor informed and in communication with the patient.
No more questions? Okay. Thank you very much,
Thank
Victor. Our
One small question. You need to open the windows a little bit here in the back, because the air condition looks like it's not working very well. So something like this.
Okay. The next step is one that some of you already know, MedRadar and Cristian Rădulescu. MedRadar actually was launched during demo day last year, so we watched your progress, and now we are interested to find out more about the development and your plans.
Indeed. First of all, hello. I'm very honored to be in front of you. As you can imagine, I have my set of emotions and anxiety presenting in front of so many professionals. MedRadar it was indeed baptized or launched during the Autumn Innovation Hub Demo Day. And we are happy to be in front of you, telling you or showing you the progress that we've made in, I don't know, around 6 months. What is MedRadar? MedRadar, it is a dream. It is the dream of any Romanian and Eastern European patient of having the information about the availability of the medicines in its pocket, or having the pharmacy in its pocket. And this is what we want to do. Why? Because I think each and every patient or caretaker in Romania or Eastern Europe had or have been in one of these situations. And it's not a very happy moment. It's not a very pleasant situation to be in. And given that I'm involved in the healthcare for more than 20 years, I've been in the same situation. I would not expect to be in the same situation, but the reality of the Romanian market showed me that it has no compassion, no matter if you are deeply involved in healthcare or not. Therefore, together with a bright IT professional, we developed MedRadar. We thought at the beginning that it is a situation which is particular to us. We couldn't find the medicines that we needed. We couldn't find the places where we can take the flu shot, or even simpler, we've been in the situation of not knowing where is an open pharmacy at midnight. But doing some research, we've identified the fact that we are not alone, we are not unique. Even though we would like to believe about ourselves that we are unique and we are special, we are not. 70% of the patients in Romania claim that they have difficulties in accessing medicines they need. In average, there are 3 visits to a pharmacy in order to find the medicine that you need. Ironically, this morning I just heard that in Bucharest, the hotspot of pharmaceutical market in Romania, there are patients which are doing more than 10 pharmacy visits in order to find a simple medicine just like vitamin K. But the situation it is as it is. There are multiple factors and the results are simple. When the patients cannot find their medicines, everybody is suffering. Maybe you will say that it's stupid what I'm saying, but a medicine which is missing, a patient which is not taking the medicine for his, let's say, chronic disease, means that that patient is not going to be economically active, socially active. He will go to the public hospitals, bringing his problem with him, and then, just like a domino, the problems will multiply. And guess who? We are paying from our pockets for the public system, public healthcare system, sorry. And we thought about what to do. As mentioned, we did MedRadar. Someone says it's innovation. We don't think it's innovation. We think it's common sense. In the age of AI, to have an app which would tell you where you can find the medicines that you need or that have been prescribed, it is common sense, nothing else. But we are happy that someone says that what we did is MedRadar. And because it's common sense, we thought that it needs to be simple. And we did it as simple as possible. And actually, with MedRadar, in 4 clicks and under 1 minute, you can find the pharmacy that has the medicine you need in stock. As simple as that. We are talking about AI, we are talking about innovation, but the innovation and AI needs to be easy to use and it needs to be helpful for the patients. What more MedRadar does, apart of finding medicines that you need? So MedRadar, as mentioned at the beginning, allows you to see which are the pharmacies which are delivering the flu shots on spot, the ones which are open when you want to find an open pharmacy at midnight, and even pharmacies which have their own laboratories within the premises. And you will see a bit later, we are not stopping here, we are going to add more and more features. What we are basing on, we think that simplicity is one of the most important features that we have. The technology, because AI, it's not just a hype, indeed it is something that it helps and accelerates innovation and development of different things. For instance, MedRadar with all the features was developed or it is the result of one IT guy and one healthcare involved person. And last but not least, I think is the most important thing, the one thing that sets us apart of our attempts, tried to be on the market in the last years, is the unparalleled data access that we have. We have a very good relationship and access to all the pharmaceutical community in Romania, and this makes us confident that we are going to increase the adoption of the app also by the pharmacies, because it takes two for a tango. We don't need only the patients, but also the pharmacies which would deliver the data. And this is what we've did until now. As a bootstrapping startup, starting from the first public demo in September last year, in this moment we have over 25,000 users every month, only in Romania. We achieved something that we didn't know that it's possible. We were ranking 4th in both Google Play and App Store as the most downloaded app in the medical category, free apps obviously. In front of us were only the private hospitals and clinics, which have, as you know, huge budgets for promotion and marketing. And a part of these things which are, let's say, ego, I think the most important things that we managed to do in these 6 months is the fact that we deployed the version of the app which is also in Ukrainian and Russian language for the people in need which are in Romania. And another module was developed and is going to be promoted a bit more actively. The one which COPAC is taking benefit in this moment, the communication and marketing module, which allows pharma companies or patient associations or whoever to have a direct channel of communication with the patients. And in this moment we are promoting the 3.5% income tax deduction that you can give to anyone in Romania to be redirected towards COPAC. So this is who we are, this is where we are, but we are not stopping here, because as the time goes by, we see that there is this need for a similar app, not only in Romania, but in the entire region. And this year, we are planning to achieve 100,000 users by end of year, to be already live in Greece, in Serbia and Bulgaria, and next year, obviously, we are going to be an app which has over 1 million users yearly, and from 2027, we are going to be even bigger and we hope even faster. The milestone or the most important development project for next year, because we are also looking forward, is this prescription and scanning reservation module, which will allow the patients not only to see where they can find the medicine, but with, again, one simple click, the patient will be able to reserve the medicine needed in the pharmacy that he chose. So, simple idea, simple execution. This is MedRadar. I'm open for question. Thanks a lot.
Wants to start?
May I have one short question about the data collection? Because for now you collected data from big chains. So I would assume this is automatically done. Maybe they have a software that you connected to. But the question is with smaller pharmacies that maybe are not using the same sort of software that they track the quantities of medicines, how do you plan to tackle that? Or do you rely on human-made input, therefore prone to human error? Thanks.
It's a very good question. Thank you for it. In the ideal world, we would have an API which would deliver automatically the data, but we know that we are not living in an ideal world. Therefore, we have an API, which is connecting with the pharmacies' systems, but for the ones which are either, let's say, a bit scared of letting someone be connected with their systems, we have the option of a human person delivering with a certain frequency the stock information directly into the app. And to answer the unspoken question but mentioned, indeed, we started with the big national chains because it's the simplest way to have large addressability, but we are actively contracting the individual pharmacies, the small chains, not sooner than last week we signed a contract with a regional chain of more than 150 pharmacies located mainly in central and northeastern part of Romania. Therefore, we are open to anyone, and we have what it takes to send the data and to use the data. Please.
So your target...
I'll keeping you in mind.
Thanks for the presentation. Cristian and I were colleagues at IQVIA in the past. He was actually my mentor. So congratulations. I think it's a big challenge and you're addressing it. So your target customers are patients. Is there any other entity, like are the pharmacies also a customer for you? Who else is the customer? And how do you plan to monetize? And also, what is the value captured besides the IP? Like, is there anything else, like data and other things that you plan to, capture with your solution?
Yep. The app, it's business model. It's a mixed business model: business to consumer, business to business, business to business to consumer. As you saw, we are bootstrapping, and until now, and for the rest of the year, we are focusing on getting the most out of the app in the benefits of patients, meaning that the main, let's say in commas, customer for us is the patient. I'm saying in commas because everything is free for the patient. And we believe that health and access to health should be free and equal for everyone. We have a plan to monetize all the aspects of the app, directly and indirectly, but we are not focusing on this in this moment. There is value at, let's say, every screen of the app. And we have a plan to monetize it.
Thank you. My question is regarding the business plan. I'm curious, how do you see this idea of having data about the stocks from the pharmacies, and the competitors of some pharmacies might know about this type of data and use it in other purposes? How do you see this, and how do you think that the pharmacies will see this?
I've mentioned along the presentation the fact that I'm in this business for more than 20 years, and I'm in contact with the pharmaceutical community for more than 20 years. The only thing that I have as a human being, it's my reputation and my capital of trust. I've been dealing with more sensitive data from the pharmacy chains and pharmacies in general, and patient data and so on, and I never crossed the promise that nobody will see some other else data. And this is one thing that I'm promising and I'm living by also when running MedRadar. No pharmacy in Romania will be able to see the stocks of other pharmacy from Romania. More than this, in order to secure and to walk the talk, the patient is not interested to see if a certain pharmacy has 10 pieces or 20 pieces of a medicine in stock. The patient only needs to see if he will find the medicine that he needs in that specific pharmacy. And this is exactly what we are showing him in the app. We are showing him only if the medicine is available in a certain pharmacy or not. Welcome.
Okay, if there are no other questions, thank you very much.
No, I thank you. Thanks.
I change a bit the schedule, and I will invite Bogdan Ivanov to present the next app, NutriCare.
Hi, my name is Bogdan Ivanov. It was a surprise for me. I suppose that it was another startup before me, but no problem, I will be now. Everybody knows the problem. I will pass quickly because lifestyle-related diseases affect a lot of us. But I focus on why. Because of genetics, because of nutrition and sedentarism. This is the risk factors, the main cause of this. And today, if you're going to medical doctor, you will receive a classical treatment. And it's based on symptoms. And the lack of holistic approach, the lack of integration, put us in the very low rate of success in this situation, what we are facing today. What we are proposing now, we are proposing an integrated approach who take in consideration the holistic medicine, the personalized nutrition, and the long lifestyle interventions. And for this, we have a lot of studies, but Harvard put it 10 years more. What we are doing, we have already early adapters, we have a feasibility assessment, a medical consultation with a medical navigator who take in consideration all the issues you have. And after that, we go to a very, very precise nutritional assessment, nutritional consultation to take in consideration everything. And afterwards, we put all the data in one place. We create a digital system for those patients who are digital literate and for those who are not digital literate, who are the most of our patients. We are going offline or we are going via email and we do not put them in the situation to use a digital app. But we have everything in place for them, for all the patients. And finally, we don't let them alone. This is the most important issue. Everybody make all these steps until here. But that step, nobody do it very, very often. And it costs a lot of money. But for people who have real diseases and for people who already are in need, not for people who are in the situation to prevent, we are here to support them. And finally, we will keep the support on the long run. The market, huge. Smart wellness market, 21 CAGR and so on, and many other markets like weight loss or diabetes, app, a lot of market. We have a lot of competitors. Everybody knows nutrition. Everybody knows cardiology. Everybody knows everything. Dr. Google is present. But this guy from Yazen, Sweden, Swedish company, received 20 million euro 3 months ago to scale the business on the global range. Why? Because he has success in that approach I show you. So we are here because we pivot several times. I'm old in startup industry. I have more than 5 years in trying to scale the business. And we put all things together now because we realize that being only a digital tech provider is not enough. Being only a precision nutrition specialist who provide DNA data is not enough. So we put everything on one single project. And we want to compete with this guy who received a lot of money. We receive for our development a lot of support. And now we are doing money from at-home nutritional testing. We started a lot of years ago developing our own genetic test, our own Nutri-genetic test. We face it with a lot of issues. You cannot do only, you cannot be a provider of genetic data and an interpretation of your data by a geneticist and so on, because it's too complicated. So we put more. We develop a digital platform, a digital nutrition platform. You can find it on Google Play and App Store. You can download it and you can play with our digital app. But we face with a lot of problems. We have users, but it's so complicated. And they don't follow, and they don't go 4 months to solve their problem, because it's too complicated for them. Afterwards, we realized that, pivoting 4 times, that we should put in place a program, a well-being program. So we put everything together, and it's not cheap. Who gives us this money? For sure he is ill. For sure he wants to bring in remission the diseases. We have early adopters, and we already sell our Nutri-genetic testing with around 800 euro tests. So we are on the premium side of the market. And for those customers who want to support them on the long range, we start partnership with micronutrient suppliers, like companies who deliver supplements to their home. And in the future, when we'll have the break-even, we will deliver your food, your specific food. If you have a cardiology problem, we'll deliver a DASH diet. If you are obese, maybe we will deliver a specific diet which have a lot of ingredients who fit with your other disease. Because if you have obese, for sure you have diabetes. If you have diabetes, for sure you should have a specific diet. Until now, as I mentioned to you, we have revenue from at-home nutritional testing, selling our test and selling our partner test, ranging from 300 euro to 800 euro per test. We use a lot of clinical studies in our recommendations. We have a network of nutritionists in Romania and in other countries, not many in other countries, but we have. We have a partnership with a German company who can deliver personalized nutritional supplements. And finally, in our digital nutritional platform, we have an algorithm, and that algorithm is in a patent pending process. Nice picture about what we are doing with our digital platform, but it's not mandatory, it's optional. For those patients who are not digital literate, who are most of our patients, and in Romania and in Europe, everybody who are over 40, 50 start to think about to improve their health. So that person, that customers, they are not so digital literate. But we have some challenges. You can look on our app. We have a nutritional assessment sector, and if you have money to buy a nutrigenetic test, if you have money to buy a gut microbiome test or other metabolomic test, we support you because from here we make money. We provide a specific diet for cardiology issues. We can provide DASH diet and so on. And if you don't want to register nothing, you can synchronize your wearables. And in our app, you can find a lot of useful data. Not only nutritional deficiencies, you can find the nutritional index, Nutri-Score, and you can find a very, very nice information, which is not in the topic today because Trump came, and the carbon footprint is not an important issue now, but it will be for sure in the future. And finally, to do not register nothing, you can connect your wearables. That's it. This is our digital platform, but as I mentioned to you, we are not focusing on this. It was our product 2 years ago. The market, huge, but we are going from nice to have, we are going to need to have. So we want patients who are already ill, who want to bring in remission diabetes, obesity, and some cardiovascular diseases. This is the team, the executive team. Software developer, geneticists, medical doctors. This is our board of advisors. This is our partner from USA who teach us a lot about nutrigenetics and so on. And until now, as I mentioned, we are old, but we receive a lot of support. The last one, it was for a market research, for a study, a clinical study from European Union. And today, we are trying to implement this final service well-being program. We receive some prizes. And yes, this is the app. We have a web version, which is not integrated with mobile. We have a mobile version. We have a landing page. This is our patent pending idea. I discuss in break if you want with you if you are interested. And yeah, this is the first slide. Thank you very much. Too much information.
Hi. Great stuff. As you said, you're a veteran, and well, while everyone was pitching, I was also doing research about what they are doing. So I noticed that you've had a company incorporated in Romania, you have an LLC, and so on. So I'm curious. I have one question, and it has two dimensions. Where do you keep your IP? And this is about geography, but it's not just about geography. It's also about where in the whole business model your intellectual property and connected to that your USP lies. Yeah. You just showed the slide with the thing you have a patent pending in. But I'm curious if you have patent pendings or any kind of research IP in everything else that you've been doing.
No, we don't have only in the procedure to assess the digital, the nutrition deficiencies. There it is the IP. Mm-hmm. In the rest we don't have any.
Which is the topic of the scheme you showed there.
I show you the graph here. So we are comparing the eating habit with the yellow line with two different systems. One is European Food and Safety Dietary Recommended Value, which is with blue line. So we make this differentiation between how you eat and what you should improve. In this example, you see vitamin D. You don't eat vitamin D, but the European Union tells, okay, you should increase a lot in vitamin D. And another system where we are very focused is comparing with nutrigenetic profile or gut microbiome profile. So this is the purple line. So instead of comparing only with European Union for Caucasian people, you can go to your profile. So this is the personalization. So there are a lot of treatments who are failed because the treatment is one size fits all. We are not here because we want to move to precision nutrition. We want to move to pharmacogenetics. It's extremely important. If you are recommend a specific drug for cardiology, you should know the genetic behind, if it's efficient or not.
Yeah, but you're a bit spread across a value chain, let's say, while this is your IP, but...
Yeah, we started, this was 5 years ago.
Yeah, but like 98% of your presentation and maybe also of what you do is not about this. So I'm curious, actually, what, I mean, if you're making today money from something, like the first part of the presentation, and then trying to pivot towards this or to evolve towards this. So I'm trying to understand the dynamics in terms of your USP and then also the dynamics in terms of geography. As said, I noticed that you have an LLC established, so maybe you give us some insight into that. Thanks.
So we started 5 years ago with this and with the procedure and with this.
Okay.
We realized that the acquisition cost of a nutritionist it's very, very expensive, and we pivot from being a provider of geneticist at-home nutritional testing, which will be used by a nutritionist who cannot use it without a digital application.
True.
Because as I show you, if you want to merge all the data and follow in the same time 30 micronutrients, not only one, 30 micronutrients, you should have a digital application. We developed a digital application for nutritionists. And we realized the acquisition cost of a nutritionist and the general practitioner in our business, it's high.
Okay, just to clarify something, that's 24 there? There's 24 there? Should that be 2020?
So now we are in 24. We was in 24, but we started it 5 years earlier.
Okay, so that's 25, and what you presented afterwards is what you're heading into.
We already have the digital platform. You can access it via app stores.
Yeah, I saw it. The nutritional testing, is that something you were outsourcing, producing somewhere else?
Yeah, we didn't have our own lab. We tried in Romania, but it's extremely expensive. So we go to USA. As I mentioned too, we have partnerships in USA and Europe with some labs. But the nutritional testing, our nutritional test, we are going to a university in USA, and because we are very, very expensive, we are using a very specific technology, next generation sequencing. We are very expensive, 800 euro. But there are in the market a lot of competitors who have another solution, not our solution, not so accurate, but enough accurate to sell it. So we are going to our partners. Where you can find, if you go in our shop, you can find nutrigenetic testing from 300 euro to 800 euro.
Okay, thank you.
This is the second iteration. And that's it. Yeah, if you
Thanks.
have other questions.
Thank you very much. Thank you.
Merci.
The next presentation is about parents and about and how they navigate into healthcare system, trying to find the best solution for their children. Ana Maria Passat, welcome.
Thank you. Perfect. Mahmoud? Perfect. It's such a great honor to be here today. And in comparison with the previous presentations, Parentis, it's still a baby in the oven, but it will be soon launched, not very far, in June. So fingers crossed, because we're really excited. So what is Parentis? Parentis is a digital health companion designed for parents navigating the medical situations with their children. We exist to reframe the parenting experience with empathy and really contextualized tools for the hospitals. Currently, I'm a clinical psychologist, and over the past 2 years, I've been working in public hospitals on the pediatric sections. And after so many interactions, especially right now at Funden Clinical Institute, I've noticed that families are going through different challenges, especially emotional shock, limited reliable information, and limited to zero mental health support. Because in Romania, there are very few psychologists working in the public hospitals at the national level, especially in pediatric hospitals. So, our solution is to offer access to self-help psychological resources, medical and legal information for them in order to better navigate this medical experience, and also resources in order to cognitively and behaviorally stimulate the long-term hospitalized children. And one of my favorite questions is, why now? Because only in 2023 there were over 160 newborns and 2.85 million children under the age of 15 are going annually for at least one medical consultations. So can you imagine how many millions of parents that are struggling with medical experience, with limited information, with a lot of stress and not so much support, especially when it comes to emotional and psychological directions. Also, as I mentioned, because there are very few psychologists in Romania working in public hospitals, we have a lot of expertise that can be used in this app, because when one psychologist is leaving the hospital, he or she is taking the experience with them. So we need to bring this up forward. So we are making the medical journey less overwhelming for all families with easy access, adapted specialized information in accessible language, audio and visual representations, because in the hospitals the parents have different levels of educations, and contextualized information for the pediatric experience. Regarding the market size, Romania's child healthcare sectors faces a critical shortage, and our solution directly addresses this massive unmet need and is designed for rapid global scalability, which is an opportunity to deliver both both a great quality and a great insurance to this factor. Parentis is the only solution that combines emotional support and expert contact for the entire medical journey, before, during, and after consultation and hospitalization. Of course, we are already in talk with European partners after launching the app, which is our next step. We will be talking in how to adapt this application at the European level, because we are working on the same protocols, especially when it comes to medical care. So it would be such a pity not to bring this application at the European at least, but to a global level. Regarding competition, while there are platforms like Parentool in Romania, Headspace and Talkspace, none of them is directly addressing this niche regarding the medical experience. So this is what Parentis is doing. We are directly combining emotional support, expert contact, and contextualized tools for the entire medical journey, before, during, and after medical consultation or hospitalization. We are not just another parenting or mental health app. We are building a niche category where real-time guidance is meeting the real-life medical care. I said we are still a baby in the oven. We are here at the MVP, which we will be launched in June, and we are very, very excited because actually our idea started last year in November when we won. We were one of the winning teams at Hackathon for Health. So over the past months, we've seen the progress, but only behind the doors. So we just can't wait to show you what we've been working on. And regarding revenues and streams, of course, it's important. At first, we will not put financial burdens on the families and parents. Everything that we will be launching in June will be free, because if someone mentioned healthcare should be accessible for everybody, and it's one of my principles as well. But of course, we need to sustain our platform, so we need money as well. We will also have a shop that the parents and the families and the people can buy important activities or games in order to use adapted for the long hospitalization. But also regarding the future, we will be, of course, addressing to the nations, CSR partnerships, and a freemium type of model business. Our go-market strategy begins with public and private hospitals, and we've already initiated conversations with the public hospitals, also the ones that I've been working on, but also with our partners, for example, Asociația Magic, who is already active in many pediatric hospitals in Romania, so they can easily help us reach those clinics as well. Regarding financial projections, because after the MVP, we really want to bring this app forward. And with the investment that we're raising, we will transform Parentees into a fully native mobile app, which will be faster, smoother, and easier to use in high-stress moments. And of course, we will integrate new features. For example, guided journaling and the smart data collector focus on the family's mental health. And most importantly, will enable secure, direct collaboration between the patients and the families and their GP, family physicians, in order to close the loop and to make sure that we connect the emotional needs, the family's needs and expectations with their GP, so that it will be, you know, an ended circle. Regarding our team, it's not only two of us, it's everybody who is believing into our ideas, our collaborators, everybody who is working right now in order to launch our platform in June. But I'm Anna, as I said, the clinical psychologist, and Andrei over here, who is a product designer and is helping with everything related of how the app will look like and how the parents will experience the app, which is very helpful because as a psychologist, I tend to be a little bit too scientific. And yeah, we are kindly inviting you to see how we checked already and tested with the medical team and with the families, our app. If you are a parent, if you are a pediatrician, we kindly invite you also to fill in the forms, and maybe during the next workshops we will have the chance also to present you the what we have for now as a demo, so that we can get valuable feedback. Thank you, and let's make the medical journey less overwhelming for all families. Mike, thank you.
I have a question.
Yes.
So how did you gain trust from parents before launching an MVP? Before they're using actually the application in a real life scenario?
Yes, as I said, I'm a clinical psychologist, and over the past 2 years, I've been working in public hospitals, at first in Iași, at the public pediatric hospital, and now at Fundeni. And of course, first of all, this app is going to address to the most common questions that the parents have in the hospital. For example, how do I prepare my child before an intervention? How do I talk to my child about the diagnosis? How do I tell him that we need to spend 1, 2, 3 months in the hospital for the chemotherapy? So after talking to them, I've got to reach to the point where I myself became a little bit repetitive, because for each family I was delivering the same information, it was working, it was calming them down. So that was the moment when I realized that I'm just only one human, and maybe I will not be working forever in a hospital. So what can I do not to feel guilty when leaving the hospital, and not to feel guilty when I'm not able to reach every family in the hospital, because the dynamic in the hospital is crazy. One day you have a family, the other you don't. So you cannot really plan your interventions. But with this app, I can really address the basics and the most common questions, the most common situations that are involved in the medical experience with the children. And yeah, the question is, by talking to them, I gained also their trust, but also their feedback.
Thank you. And a second question, how much AI you leverage into the application?
Right now, none. And I have a reason for that, because we were really a little bit, you know, pressured to use AI. AI is great, especially ChatGPT. If you're asking how you're feeling, he's gonna give you a lot of great responses, but they are not really scientifically verified. ChatGPT, in comparison to a psychologist, doesn't ask more questions and is always giving you a direct response, which in real life, that might not be the solution. In real life, when you're going to a psychologist looking for answers, it's actually you trying to understand the context that you are in, and sometimes you don't really need a direct answer. So everything that we will be using in our app is already from international guidelines on how to communicate with patients and with the medical staff. And if we are going in the future to integrate an AI, it's going to be a little bit expensive because we want to train our own AI to work with the scientific resources that we will already have checked.
Thank you.
Thank you too.
So basically you work as a chatbot right now, but you want to train your own LLM later on, let's say.
Sorry, I work as a...
Not you, but like Parentis.
Parentis,
works
yeah.
as a chatbot right now, so it's just chatting based on a script, let's say, and scenarios, right?
Thank you for the question, because I want to clarify, it's not a chatbot. There will be written articles with also audio-visual content. For example, I will be the psychologist answering to the questions. When the parent opens the app, he or she can see me talking about what is going to happen. Yeah, because as I said, in the hospital, some parents are not really well educated. They cannot read really well, but also when there's emotional shock, our cognitive activity is a little bit limited. So when we are in shock, we cannot pay too much more attention in order to read. But when there's somebody, a specialized psychologist talking to you, you can say this to your child, this is normal to happen, you can experience this. It can already have a much greater impact, and also hearing somebody else's voice can really calm you down. Because when we are reading, we are actually reading with our anxious voice. So that's why we need audio and visual to ensure that everybody has equal accessibility to the information.
Okay, so it's a very well curated one-stop shop where you find all the resources, the support, but it's passive, so it's already recorded.
Yeah,
right?
exactly.
Okay.
And we will also have a hub of specialists, parental counseling, psychologists, psychiatrists, pediatric in this area, so that they can contact later
so to access more personalized support.
Exactly,
okay.
yeah. In the future, after the MVP, our ideas are really crazy in a very good way. We want to create this app to be easily personalized with the experience in the hospital, to monitor, to observe all the effects of the treatments on the child, and to give them specific activities that they can do for the long-term hospitalization in order to, you know, increase and make the experience better. But that's not our step now. We still need to launch it in June. And after that, of course, our mind will go crazy with what we can do, hopefully.
So this is kind of heading towards what I wanted to actually ask, because I noticed your model with premium, where corporate, I think, sponsorship was a revenue stream. And I have a bit of a worry there, because most likely when you go towards corporate sponsorship, they're going to also come with strings attached related to the content. So that might maybe come with terms and conditions of maybe pushing, promoting whatever other resources, services, and so on, which, given your vision and your drive, which is about helping people, might dilute that. So I'm wondering if you also considered a different sustainability model for the app, so that you don't depend on corporate sponsorship, which might give bias to the content that you put in there.
Yeah, it's a very good question. We've also taken that in consideration. I think the best way is to testify and to check. Of course, we still need data. In Romania, there is not enough data on mental health. So, of course, service might be a benefit also for our app. Not mandatory, but for parents that would like to complete. So I'm not completely excluding this, but maybe when we'll encounter the situation, we will, of course, take all the risks in consideration not to make our app biased or too commercial.
Thank you.
Thank you, too.
Thank you. Keep the finger crossed for the launch.
Yeah.
And we also would like to be a partner for you and help you, because I think almost everybody from our team is a parent, and we know what you are talking about. Thank you.
Thank you too. Thank you so much.
I invite Marilena Ianculescu for the last presentation. Marilena is from National Institute for Research in Informatics. It is not a startup, but they have a very good department of health research, and she will present us one of their apps, EMO Monitor.
Thank you very much, Luminica. Thank you, everybody. Yes, we are not a startup. Actually, our institute, ICI Bucharest, it's going to be 55 years this summer. So we are quite a grandparent for a startup or a dinosaur in terms of IT. But we are working as your companies, because we have no any budget officially or privately given to us. So I'm going to present you a small solutions developed by us, and think of it as something that is a demonstrator of what we can do, and as a part of other different types of IT solutions. We are also able to sell it. It's just being finished. It's not clinically tested yet. And I hope to find you partners and interest in more development of this solution and other based on our competence and experience. What is EMO Monitor? EMO Monitor is a system intended to evaluate and to make a patient or a citizen profile in terms of emotion. It's also designed to be used by specialists, by psychologists, or other types of medical physicians that are interested in make a stronger relationship and based knowledge about the personal information from emotional types for every person that is involved in some type of medical problems. But it's mainly thought as a relationship and a well of awareness and more responsibility for the person that is using. I'm not as actually using the term of patient in this system, but it can be a patient or a person that is in contact with a psychologist. From this display, you can see what are the main functionalities that are able to be used by a person, by a citizen, by an individual. So, based on the functionalities provided by this system, some weekly reports can be generated and also downloaded. There is a functionality based on physiological parameters, which are measured by some smart devices. I'm going to tell you about them. Some questionnaires which are structured on different types of emotional profile and emotional personal experience. We have functionalities able to recognize emotions based on an image or on a video, and also from the voice, analyzing of the voice. These tools are based on AI, and they provide basic information in this demonstrator, this EMO Monitor, classifying mainly the emotion in positive, neutral, and negative, with some small sub-classifications. We also have a functionality based on a device, Brain Muse. We are not going to insist in this presentation of it, which has two functionality, basic answer functionality. Based on EEG waves, it can analyze the state of emotion, and at the same time it can provide the support for a better mindfulness and better wellness and aware. The user, the citizen, the individual which uses EMO Monitor has the possibility to write in a personal journal its impressions from a certain event that happens, or some bad day or a good day, in order to be able to see about what is the evolution of his state of mind. And also, all of them are based, can be correlated with a personal emotional history as a patient profile, similar. And which is very important, we also provide informative materials, of course, which are quite not very professional ones from very demonstrated reliable sources. So, in the same time, if the user is associated, is the patient, is the client of a psychologist or a physician, this information is presented in this part of the application, and also it is linked in the same time with the specialist. We are using 2 Whitting's devices, which are smart devices, in order to measure tension, blood pressure, and the temperature. Why these devices? Because they provide, without any additional cost, the measured values, and in the same time we can gather this data, which is very important. Health data is very, very important and it's a sensitive data, so it needs to be fully controlled and to be used to generate more knowledge and information. That's why these devices, which are certified also they are produced in France, they provide this data, and we were able to brought them in our database and use them and protect them and secure them. So, based on this measured data, the patient, the citizen, the individual, has a record its emotional state based on these parameters. It's not important, it's not necessary that all the 3 parameters to be measured simultaneously. I make a small information. Let me complete with some more information, that everything that is going to be seen in this presentation will be demonstrated, if you are interested, in the second part of this event. So, the user has every information that is needed, and tutorials and help and background information presented on screen in real time, and can be seen in real time, and also be recorded and seen every time when it's necessary. Okay, so about the facial recognition is based on an image, on a video, and the users can consult the testing history, can see charts and reports about their evolution and the historical emotional state, and please come after lunch and see how it is working in real time, and you can analyze your emotions, and you will see that in the same time your emotion can express anger or joy or distress. So another functionality is the voice analysis. So the user is reading a defined sentence, and based on this voice, on the analysis of the voice, so it is put on a chart expressing different types of emotion, like fear or anger or happiness. Okay, so in the same time, we have different other functionalities, as I told you, and all this recorded data can be seen and put in different types of reports. First of all, the emotion distribution with pies displaying the position of positive, negative, and neutral emotions. The emotivity level, charts illustrating how well the user can control their emotions. Emotional intelligence, from questionnaires and tests. Relaxation taste based on EEG muse. And predominant emotions. Okay, this is from the point of view of an individual. From the point of view of specialist, if an individual is connected with a specialist, the specialist is able to see all the recorded data except the personal, historical, emotional, which we thought it is quite private and available only to the individual user. So all the functionalities on all the results of the functionalities on the individual user are available to the specialist. Furthermore, this specialist has another specific functionalities called professional observations, in which it has the possibility to also to record in a file, as it has on its personal files, all the information and all the personal observation, but at the same time, it can choose from some predefined states of emotions and physiological information classified in 3 different structures: general emotional profile, how its behavior and observe attitudes, and reaction to stress and pressure factors items. All this data and all this information are put together in a personal profile of the patient, which can be accessed from a mobile phone, from a phone, or directly from the personal computer or tablet and whatever it is. So this system is, as I told you, just a demonstrator. But we are working in developing and putting it much closer to real clinical practice, in order that we are transforming it to be able to detect anxiety, depression, or stress. We are thinking and we are working also not only for the different types of medical specialties, but also from professional environments, able to be used by resources, by human resources departments. So if you have any ideas or any proposals to develop further this system or others, we are here. And please come after lunch to see the practical demonstration of all these functionalities. Thank you very much.
The need emerge to develop such a solution?
How this?
The need for such a solution emerge.
The needs, sorry?
How did the need for such a solution emerge? Like, how did you realize that there is a need for this solution?
We are working in IT e-health for more than, I'm working for more than 30 years. So we have developed many digital solutions. And in the last 20 years, I think we have been concentrated on aging or anti-aging solutions, which are very much alike associated with depression and emotion. And this is a small solution that is integrated in and will be integrated in our more complex digital solutions that we have. So we are working now in a project that sustain neurodegenerative monitoring and management of neurodegenerative diseases in Parkinson, Alzheimer, and multiple sclerosis. And emotion part is very important in order to sustain the patient. So this is a solution which can be more rapidly put into practice and tested in order to adapt it for depression, anxiety, and stress.
So
in
is it
larger
correct
program.
to conclude that speaking with psychologists and specialists
Yes,
like this need came across? I'm asking because your target customers seems to be physicians or like clinicians, psychologists, and patients, and I wanted to have an understanding if this also came from them in terms of we need to, like if there is a
our functionalities and our need of data and our very large range of medical data that we are using in our other projects have generated our proposal to this idea. And emotion is very, let's say, emotion and depression nowadays are very commonly met.
And another question, it seemed to be a lot of data and it's all useful. The collection of it is expected to happen during during the visit, during the, during the clinical visits, or also like the patient will have to put the inputs every day into the platform.
No, it's automatically done. ICI Bucharest has a cloud. So everything is arranged in order to be less visible for the user. So there is no need. It's just to press a button and everything is recorded and secured in our cloud.
Okay, and it's done by the clinician. Okay, thank you.
Thank you.
I was curious, who's using it today, or how are you testing, validating it? Do you already have some users in it?
No, I told you that we have just finished the solution a month ago. So we are, that's why we are here.
Okay.
Trying to find, let's say, possible partners in order to demonstrate and to test and validate the solution.
Okay, so the development has been funded. How was it a project? Sorry.
Internally, by our.
By your own resources, and what's your, let's say, exit plan for it? Are you planning to sell it? Are you planning to incorporate it as a spin-off, or what's the?
No, we are not able to transform it in a spin-off due to our political made by our institute, so by our strategies and how we perform and we exist. But we have a department that is specialized in technological transfer, which support us in order to create a product that is able to be sold. And in the same time, the next way of making profit of it is to integrate it and transform it and adapt it in our research projects that we are doing or we are planning to do, or to be taken as partners in other partnerships, national and international level.
Okay, thank you.
There is another question.
Thank you for the presentation. So from our company BEIA is collaborating with ICI, and maybe also an example, we tried to go to the market with one of the modules for voice recognition. So we have requests from our customers. We install also communication centers, let's say dispatcher systems, and they want to analyze also the agent that is answering the call, but also the customer. What is the sentiment, let's say. And similar question is how you want to go also internationally, or do you want to go more nationally with it?
With you, Mr. Suciu,
okay.
as always.
Thank you.
So I know Mr. Suciu for many years, and it's a very valuable partners and competitors in the same time, but I prefer to call you as friends. We try to make several projects together, and as you already know, we have let's say the thought together to make a solution able to address stress and anxiety and stress. afterwards, we have tried to develop such small solution in order to make our, let's say, our fingers to be able to have a solution that is ready to be used. And with our expertise and based on these functionalities, we are ready to adapt them and to address and to transform them to any international competitions or level, be they somewhere.
Thank you. So it's
us.
ready
Yeah,
for international.
Thank you very much, Marilena. Thank you.
The last presentation should be actually the first, but I think it's a good end because now we are talking about the Shift Hub, the project that brought here together, and Alena Bubek is the coordinator of this project. Alena, you have the floor.
Yeah, thank you very much, Luminita. So I'm actually trying to make it very short, not to steal more time from the workshop, but I mean, the event today is hosted by Shift Hub, so of course I would like to share some insights from our project and actually what we're offering. So Shift Hub, it is a European project, of course, but what we're really aiming at in doing with all the money that we get from the European Commission is to build a smart health innovations and futures technologies hub across Europe. So this means having a pan-European network that really fosters the development of smart health solutions, promotes the uptake, and just brings these solutions actually to people. Because it's great that you're doing like a lot of work putting into your solutions and testing them, but actually the value is created when they are being used. So this is one of the main aims that our project is focusing on, and we have a lot of partners, great partners, that enable us to actually do this great work. But what we really want to do with all the activities and events that we do is facilitate development, ensure the promotion, and then really foster the uptake of these smart health technologies. And this is all based on the fact that with our hub and the network we create, we really want to provide services to all kinds of stakeholders in this ecosystem of smart health applications, and not only provide services for each of these stakeholders, but to really connect them and bring them together. So the services that I would just really quickly like to give you an overview about can be clustered into 4 pillars. So we have the first one where we really want to build and support the smart health community across Europe. So we do this by the community platform that is hosted, where we regularly host events, workshops, matchmaking opportunities, and also one key initiative here is the focus group on digital health, where we really bring together experts from SMEs, healthcare providers, public bodies, research organizations to really get together, discuss and collaborate, and then also create concrete ideas and policy opinions that are then promoted and influence really the decision shaping in the European smart health sector. So by becoming part of this focus group, you can also actually become part of this decision shaping process yourself. And the second pillar is, or kind of includes all the services that we provide to really support smart health products. So they range from generating an idea over finding the right partners and funding access to actually showcasing your solutions to the end users there. So we have different activities and workshops. So for example, we would start by open innovation workshops where we focus on generating ideas and really road mapping to outline implementation plans on how your ideas can be actually brought to life. Then the next step would be, for example, matchmaking events where we bring you together with partners so you can actually realize your ideas and not just have them in your mind but put them out there. And then the next step would be, of course, getting into the implementation. So how do I access funding? So this is where we support you, for example, like the pitch sessions this morning, bringing you together with investors, preparing you for pitches in front of investors, Or another thing is access to health data to support you with the development of such solutions in our smart health data space pilot, which is kind of a data sharing platform. And then also during the development process, we provide opportunities to showcase and test your solutions then with the end users, such as in our living labs, which is also an activity we're going to have in the afternoon, to bring together technology providers and developers with the end users. So you can really get direct feedback from them to improve your solutions and then actually foster the uptake later on of your solution even better. And then, of course, once your solutions are market ready, we also have demo days where you can showcase them to end users, healthcare professionals, even more, to have like a larger promotion of your services and your technologies. And then the third pillar kind of summarizes the activities which are more directed towards patients and citizens. So we have educational resources on our website. We even have a gamified user journey on our website with mini games where patients can play and learn more about healthy living, healthy lifestyles, and health-related topics in general. And then, of course, also the living labs are directed for patients and citizens, that they really learn more about emerging health technologies, the ones that are currently developed, and that they can actually provide their feedback and tell them where are the needs, where are demands, to be part of their co-creation process. And then the fourth pillar is more about sustainability and replication of our services, because European funding ends at some point, but of course the hub and the network we create, that should live longer, and yeah, we want to really build that in a sustainable way. So all the actions under that pillar are supposed to, provide our services in the long term, even after the funding has ended, and then also really involve here policy and decision makers, and also pave the way from the legislative side for the uptake of the smart health solutions. Because you know there are a lot of regulations and things that can hinder you, even if you have great solutions, to really put them on the market. So these are also activities we do under this pillar. And what we actually want to achieve is really create value for all these stakeholders which are involved in the smart health innovation ecosystem. And this is just a short summary about the value we create with our different activities for certain stakeholders, so technology providers, healthcare organizations, healthcare professionals, even knowledge and infrastructure providers. So we have different opportunities for networking and knowledge exchange for all of them. Then for the technology providers, the support in product development or even promotional services. Also for research institutions, the possibility to validate your research in your context using a different cohort or a different data set in the living labs, for example. Or for the healthcare practitioners really and the patients to become part of their co-creation process and be involved in the development of these solutions to really make sure that they are tailored towards the need of the end users. So we're around all day, and other than that, you can find all the information also on our website, follow us on LinkedIn, and we would be very happy if you would consider becoming part of our community, so the Shift Hub community actually ourselves. So you're up to date with all future events, get in touch with the people who participate in the events, so really connect you with the people you need for the next steps. So yeah, thank you very much. And I think, yeah.
Thank you. We are very, very late, so we will probably speak about Shift and about all the presentation from today, also at lunch. But until lunch, please have more patience with us, because we have also a very interesting workshop realized in partnership with UEFSCIDI. So, Raluca, Oana, please.
What should I... Trebuie să o prezentare?
Hi everyone. So this is not a pitch, actually we are going to present a Horizon funded project we're part of, which has among its main target groups entities that you might represent. The aim of this project is to build a borderless European digital health ecosystem. In order to do that, I think I'm going to skip quite fast through the presentation so that we have time for lunch. The project builds on the European context, which compared to the US and China, the EU lags behind in digital health innovations, and the health ecosystem are quite fragmented. This is a complex issue which needs cross-regional solutions, because we have in the EU huge asymmetries between the regions. The project, for example, aims to bridge countries and target groups from different regions of Europe, some top runners, strong innovators like Netherlands, Denmark, other moderate and less developed like Greece, Italy and Romania. Why is health innovation important? It is important because then we speak in vain about the digital decade for Europe. This is also a growing market, but also an imperative need for Europe to address. Among others, the project has the following goals: to connect private, public, academic, civic sectors, so all four, and to support startup scaling and create new value chains, for example, via JPIs and PCPs. Of particular importance is tackling the demographic changes and also the silver economy opportunities, which, as we have seen in the previous presentations, are true opportunities to explore. Romania in this project is represented by UEFSCIDI, the National Smart Specialization Authority. We aim to help more hospitals and clinics to use solutions developed by startups, and to help the startups grow and expand internationally. We also have some positive trends in Romania: the growing number of startups, as we have seen, more adoption of digital solutions by doctors and hospitals. There is a stronger interest from the private healthcare sector. The target groups, probably some of you, if not all in the room: solution developers, startups, SMEs, large companies, universities, end user organizations, and solution buyers or users and buyers, public sector bodies, hospitals, private healthcare providers. We aim in the project to create new value chains in specific sectors such as medical imaging, and we give a special interest to startups and scale-ups, which will be prioritized. The focus of this small workshop, which we will carry on quite dynamically in 5 minutes, is to do a sort of refinement of these 4 innovation challenges, or in other language, the 4 main needs that the project aims to address. And we aim to refine it and to put a bit more color on them, because they are designed, they are drafted, let's say, from an outsider view. And these 4 needs or challenges of the projects are deep tech innovation, digital innovation for remote care, European health data space, and addressing the health workforce crisis. The first one aims to, deep tech innovation aims to find advanced technology solutions for the elderly, disabled, and less and more vulnerable groups. For example, the aging population is given a particular focus, and we aim to fund here towards the end of the project projects that focus on deep tech, ICT technologies, AI, big data. And why now? Because this area is growing very fast. New developments are launched every few months. Machine learning and large language models can break down barriers in healthcare. And home care robots are becoming ready for real-world use. Here I would like to just stress what's the difference between the first and the second need. So the first challenge is called deep tech innovation, and let's imagine, for example, medical imaging, where the use of technology, and especially in the software part, is largely important, but also the development of new physical technologies, and, for example, digital twins, compared to the more popular challenge of personalized and human-centric remote care. As we have seen, we have many apps which tackle this challenge to offer human-centered or personalized remote care via emerging technologies like big data, Internet of Things, sensors, P for medicine, predictive, preventive, personalized, participatory. In terms of remote care, why is it important, apart from the easier access to the market, which is the largest population? In rural or island communities, there is a limited hospital access, and new tech combination are quite ready for real-world use. The third challenge is a bit more technical. It aims to advance the European health data space, where in order for this to be functional, there is a need for the interoperability of health data between the regions. This raises some concerns about GDPR and national regulation. And we expect soon a new European law on this topic. But without the European health data space, we cannot have a real-world and accurate research, because the secondary use is to boost research and new innovations with real-world data, and the primary use is to improve the care quality for patients. And here we have as target groups data providers like hospitals and data users like startups. The last challenge addresses innovations, digital innovations to tackle the health workforce crisis, because we do have a big shortage of healthcare staff, especially nurses, and even after COVID-19, very little progress has been made in the management of healthcare staff. And these innovations can reduce the workloads of the staff, improve care coordination, and help the staff in the healthcare system stay healthy, skilled, and motivated. Given these four challenges, now we will invite you quite briefly, and this is not just based on the Romanian picture. What do you think each of these four challenges or needs have? Which are the strengths, opportunities, and barriers in order to succeed with a project trying to tackle all these four challenges? Thank you.
We have a methodology, but we propose to change it because we need to fit the time. So we have here each challenge on a flip chart map, and the idea was to work in small groups, but I think it's better to give you some small post-its, and each of you write an opportunity, a strength, or a barrier for the topic, for each innovation challenge, and then we can have discussion, and then we propose you to vote the 4 innovation challenges based on the importance you think they have for a future founding program. Thank you.
So maybe not all challenges are relevant to you. So if you have a blank mind in regards, for example, the first one is deep tech innovation, then maybe you should wait for the one which you found more relevant or more interesting for you. Thank you.
Could you bring up the slides with the challenges again?
Yes, of course. Yeah, here again I want to stress there is a difference between the first and the second, because the second is more centered on remote care, whereas the first includes all the developments. Think about all these new machines and softwares to predict imaging and diagnosis.
So maybe if someone have some ideas related to challenge number 1. Yes.
The barrier for the challenge number 1, in my opinion, is the access to data from hospitals. I'm curious how we can obtain, as potential startups, access to this type of data. For example, data about patients' analysis from a specific disease. And this data should be organized in the hospital, and the database should be organized by the hospital and then translated or transferred to this innovation deep tech hub or something like that, or data space. So how can this work in Romania, for example? Do we have some partners involved, a strategic plan to start this transfer of data, and in order to help the startups create the solutions? Thank you.
I think this is actually the challenge number 3.
Yeah, thank you.
But here I would also say that this is the challenge number 3, but this challenge, which is the third one, is quite bleak, not so very appealing. It doesn't sound like, doesn't generate a lot of ideas, because it's such a basic need. You don't have access to data, and even if you do, one clinic uses one software, another one another software. It's very complicated to integrate them. But as I said, a new European law directive on this topic is expected soon, because in the absence of centralized metadata, then you cannot do predictive medicine. So this, I would say, feeds into the first one, the lack of data from hospitals. It generates probably the lack of imagination in the development of particular IT, let's say, based needs. So these are interconnected. So we can just say that challenge number 1 and challenge number 3 are feeding each other.
Thank you. Someone else? Yes.
I have another barrier for the first one. So I think that irrespective of the sector you're looking at, if it's digital or health, like language barriers are a huge problem to really secure equal health. I think all these solutions need some multi-language and easy language options to kind of really provide equal health for the entire populations, because different population groups have different barriers, and I think that the language itself and also using like easy to understand language is sometimes a huge barrier that people do not really use these deep tech innovations.
So what you're saying that there are some solutions on the market, but they use an advanced or fancy technique to medical. So they don't, for example, you have a very good app which is for free or costs very little, but people don't use it because they don't understand the terms, correct?
Yeah, exactly.
So probably we can summarize it as the innovators need to be more educated into marketing for the end customer, with all its different categories. Okay, thanks.
Yeah, I struggled with opportunities for the first one, sorry, but I found one. I think the growing digital literacy of population in EU worldwide obviously creates an opportunity for using deep tech innovations to secure equal health. At the same time, the growing digital maturity of business, both generally and in the specific sector, is also supporting it. But then obviously I have a couple of barriers. One barrier is related to, in our specific case, the deep tech gap, or the gap in using deep tech between EU, or we can look more specific at Central Eastern Europe, and US and China. I mean, China is completely non-regulated compared to Europe, and US obviously is more flexible on and more intrusive on working with private data and advancing deep tech. So we're kind of lagging behind. That can be an opportunity as well, but for now I keep it as a challenge or a barrier. And then the other one, and this is particularly in the case of Romania, I think it's usually visible with e-health, digital health startups. Compliance. Compliance is a barrier, specifically with its subsequent challenges, which is the cost of compliance, and obviously the knowledge, the know-how, the lack of know-how actually, because many times you see startups or innovators not planning for compliance and not being aware of the cost related to compliance. So.
Perfect, thank you. That's quite accurate.
Someone else?
So my opportunities and barriers are common to all the 4 challenges, because you talk about the skills, the skills for digital skills for patients. I think more important, not more important, but at the same level, the digital skills of healthcare professionals. This is a big barrier. Also, in terms of opportunities, I think this is an opportunity to leverage existing databases, because in fact we have a lot of databases that are not used, so this is an opportunity to use them. And of course the other barrier is the integration of the digital health prescriptions in clinical practice. This is we need to be financed about these new technologies. So this is for me the most important ones.
Thank you.
Someone else?
I think one of the barriers in the time we are living now is cybersecurity threats that people are aware and afraid of, and sometimes they are cautious and very reluctant to share personal sensitive information, and that's something we all should have in mind and overcome, seeing as an opportunity at the same time to strengthen the cybersecurity and inform the people.
Yes, actually, on deep tech innovation, one potential successful project would be to exactly how to tackle cybersecurity threats, because this exists in everything that is digital. So you cannot stop innovation just because you have a potential threat.
So a couple of things, and I think this emerged from the discussion I've been having with medtech companies, like large corporations who have an interest in Romania. And some of the challenges that came was the lack of an HTA or even value-based procedure for hospitals to justify the acquisition of digital solution or even medtech solutions. Another challenge is, if we speak about hospitals, it relates to the fact that budgets are quite limited in terms of budget. And it's either regulatory or it's will, but oftentimes, if you don't have budget except from the national budget, you're quite restrained in terms of how many solutions you can acquire, or the diverse things that can impact the adoption.
I think I found a barrier, and all of us will fight with the situation that low digital literacy on non-communicable diseases, patient should be very, very heavily to be onboarded in special services like remote care. And an overcome could be that providers should offer a flexible service offering with or without digital technology.
Thank you. Someone else want to add something here?
For the first one, limited, I will mention limited health infrastructure and the quality of this infrastructure for digital solution. And another one will be the access to the infrastructure of vulnerable people. And as a barrier, I will mention slow adoption of medical professionals due to the fact that they need to change their entire business.
If there are no questions on the first one.
One more that I'll add. I've been working also extensively on access to healthcare services in rural Romania, and we see, geographical disparities with regards to availability of hospitals, physicians, GPs, and so on. So, an opportunity that I can see is the need for having telemedicine in rural areas, or engaging more with the GPs for patients to access specialist medicine without needing for them to travel to hospitals.
So for the second one, please do the same. Think, yeah, a barrier and an opportunity.
For the second one, for an opportunities, I found that the remote care is a good choice because it has access to care for rural population, because they are suffering from loneliness, first of all. And another one would be the reduction of hospital overcrowding. And for a barrier, the lack of trust in remote diagnosis and the insufficient integration of remote care platforms.
For the second challenge, I identified a barrier. Not every person is the same. How do we prevent the bias? And I think this is an important thing to consider.
A challenge would be also the regulation. So data collection is not so easy. You need to follow the GDPR, but also opportunities now, new technologies like 5G and beyond 5G, so fast internet that is available, so you can do also video and real-time interventions.
As we saw in the previous session, plenty of pictures on remote care, apps, devices.
Great. Someone else for the second one? No. Okay. Yeah.
An opportunity can be the development of new sensors, because in fact when we are talking about remote care, we are not about a video call. We need to develop opportunity to develop new ones. And the barriers, I also tell, that is the skills, digital skills of healthcare professionals and patients. That is common to all these common.
Great, thank you. For the third innovation challenge refers to advancing the European health data space. Someone has...
From our company BEIA, we are working with data space, and it is quite a difficult ecosystem, and is still under standardization. So one challenge would be the standardization and access to this data space, and the other would be also training and education, because it's a completely different way to share data, access data, monetize data as well.
Thank you.
Thank you.
I also have an opportunity. I mean, the biggest benefit is probably making use of more health data that is collected. I mean, this is why the EDHS has been invented. But really, like also speaking with our stakeholders, so having access to data and sharing data across hospitals within a country, but even across country borders, is the huge opportunity that everyone hopes for, that it's implemented.
Thank you. Is there any...
Yes, thank you. So for the barriers, the interoperability, I think, I don't know if it was mentioned, but it's a big
challenge. It's the focus or the goal of this challenge.
And the European health data space is an opportunity in itself, but we need to see how to grasp this opportunity.
Okay. The last one addresses digital innovations to tackle the workforce crisis in the healthcare sector.
Yeah.
An opportunity for this challenge could be use of LLM technologies for the faster sorting of patients in the emergency room of hospitals based on the described symptoms and their medical history, if it is available.
Thank you. Other ideas here? Sorry.
Also, an opportunity for workforce crisis, it's prevention with the digital innovation. secondary prevention, but also primary prevention, because hypertension is a very big problem in Europe, also in Romania, and with the digital innovation platforms, you can use this for primary or secondary prevention. prevention.
Thank you.
One barrier can be the attitudes faced to technology of healthcare professionals.
Thank you.
One opportunity would be, of course, as colleague mentioned, large language models, so artificial intelligence, generative AI in particular, so which can generate and have some diagnostics as well, and analyze images and analyze diagnosis, so become like a virtual doctor or virtual nurse, as we have seen today, and also opportunities to have more data, so we can improve this artificial intelligence.
Thank you. Thank you. So now that we have a picture on the challenges, let's think that tomorrow we'll have the opportunity to have an open call for innovative project within Unite or different other funding sources. And we need to put all these challenges as call conditions. So let's vote to see which one should be on the first place in the call, the second place, third place, and fourth place. So let's vote them based on their importance for you. And for this, my colleague will give you 3 dots. Please consider red for 3 points. So vote the challenge that you'll give 3 points. Orange, 2 points, and the blue, 1 point. And let's see the winner.
So the idea is that not all 4 are as important in this project. We have several countries. For some of these are more relevant than others. So we try to get a refined picture of the, let's say, even if it's not just Romanian partners here, of your point of view.
So red 3 points, orange 2 points, and blue 1 point. Here, it will be great if you will, yeah. So 3, I don't know how, maybe we can put
we can put on the wall, so with some like here and
so maybe we. Sau putem să le ținem.
Just a second. Sau Tesa din ăla ce ai pus. Tesa. Just a second. Feel free to do that.
Sau putem să le ținem. Așa.
Mulțumesc. Here we have one.
Pe ușă, cred că putem să punem pe 2.
Second here.
The third here și the fourth.
Here. And one will be here. And for the moment,
Okay, so yeah, it's the thing. So, yeah.
You can start gluing the dots, yes.
Maybe it will be great to move a little bit before the lunch.
Yeah.
Acolo sus este deja...
Pe ușă. Deci ar trebui să...
So once you're done, the lunch is upstairs.
Asta e ultima chestie? Păi, trageți voi niște concluzii la workshop? Ce și pașii următori?
Vrei să luăm la rostul și râs? Punem la presa și râs. Nu e pauză încă, nu mai durează 2 secunde, vă rugăm să luați loc. Da, vă rugăm să luați loc.
Da. Deci care e cea mai votată? Workforce. Workforce și remote care. Okay, so we'll calculate the points later on, but if you look at the colors, I think the most voted is this related to digital innovation to battle the health workforce crisis.
The second is the one on remote care. So they are both complementary, as you just said, because in order to ease the pressure on the staff, you can do that through digitalization or digital innovation through remote care.
So we have workforce, we have remote care, then it's okay. Then we have innovation for equal health for the population and advancing the European data spaces. So we'll keep you informed about the future initiative of the project, but the main idea is that your contribution, thank you for this, will be sent to our consortium partners that manage the calls, and we'll have at the level of the consortium a meeting to decide the topics for the calls, and they are expected to start this year, late autumn, and next year probably for Romania, and we'll keep you updated. The main idea is that there will be calls under the innovation, the National Innovation Founding Criteria, so they will be open to all innovation organization according to national legislation. And if you want to read more details on this, maybe you are familiar or not with the national criteria on our website, Executive Agency for Higher Education, Research, Development and Innovation, or we can provide you more information about this later on. Thank you so much, and I will give the floor to Luminița to end the meeting. Thank you.
Thank you very much. Thank you. Before the administrative announcement, meaning the lunch is upstairs and it's waiting, I will ask Paul to say in a few words what are the next steps of our program.
Thank you, Luminița. Thank you, everyone. So I need a few seconds to process this because I wasn't prepared. But basically, the next step. So concerning Shift Hub, the idea is that we will organize a few other events by the end of the year. In particular, 1 or 2 startup pitch sessions online with pan-European investors. There will be an open innovation workshop focused on helping you to identify partners and to apply to European public funding opportunities. You already have here some of the partners, and the idea is to connect the ecosystem to other countries. And last but not least, to transfer the legacy of the project, and this is why the collaboration with UEFSCIDI and with other projects is essential. So I would like to encourage, because today, let's say that we didn't respect the initial timeline, but it would be great if the ecosystem can continue working together, if you can meet again and on the one side, maybe build on what we've already accomplished and take that further. Also, Octave is not here, and Stefan, but the initiative of, let's say, having an experimental area at the university, Gabi, you are here. So I found that idea rather excellent. I think this is what's missing, and I said at the beginning that Stefan's approach, since he's immersed in the medical ecosystem, is a step way forward than typical startups have. And this might help, I think, everyone to create tighter bounds between the research in the medical area, but also in other areas, ICT and so on, and together help better the core target groups, which are citizens, patients, medical establishments, to do easier and better the job. So this would be in a nutshell our next steps. Thank you so much for the organization and for hosting us, Gabi and the team. And yeah, I think we will have a well-deserved lunch break.
Thank you, thank you. We also want to keep in touch with all the startups and see what advice and what other help we can offer in advance until the financing and the workshops that Paul was talking about. So I will invite you all upstairs for a lunch break of 14 minutes, shorter than in program because you are very late. And then we all will meet here for trying the apps, for talking about them, for demonstrations. It's okay? Here and in the other room. We will open that door and create a space for demonstrations. Thank you all. And